Alright, hello everyone. My name is Jennifer, and this is my patient Amber, who I'm going to be doing a HEENT exam on today. So I'm going to start off by washing my hands, and while I'm doing that, I'm going to go ahead and just inspect the head and neck, looking for any scarring, abrasions, stuff like that. So I'm going to start by examining the head and the scalp. I'm going to look at the hair, I'm going to touch her scalp and skull, make sure there's not any contusions, indentations, anything like that. Then we're going to go ahead and we're going to feel the temporal arteries. And then I'm going to move down to the temporomandibular joints. And go ahead and open and close for me. Okay? Any pain there or anything? No. Okay. So next we're going to do the we're going to move to the eyes. So for the eye exam, Amber wears glasses, so we're going to leave those on for part of it. Then I'll have her take them off later to look at the pupils and stuff. So for right now, though, we're going to do the confrontation test, which is testing peripheral vision. So go ahead and tell me when you see my fingers move. Now. Okay? Yes. Yes. And we're going to test all fields like that. So she had no issues there. Now we're going to test the 6 cardinal phases. So for that, I'm going to start here and I'm going to have her follow my finger. We're going to do these in all 6 areas of view. Okay, so now I'm going to go ahead and have her take them off. And for this, this is my pen light. I know it's an otoscope, but it's my pen light right now. So this I'm going to check that our pupils are equal and reactive. So I'm going to shine my light in there, and I'm going to make sure that they're reacting to the light. Both the right and the left side should react. Okay, and while I'm doing that, I'm looking at the sclera, making sure it's white and not yellow or anything like that. And so then for the Snellen eye test, is a test that's on the wall, the ones that you see at the doctor's office, that measures visual acuity. 20/20 is normal vision, what they consider normal vision. So the test is on the wall that's 20 feet away. So if a person has 2200 vision, a normal person can see from 200 feet away what that person can see from 20 feet away. So it can measure different vision. Okay. So for the next, I'm going to do the ear exam, and I will have my otoscope for that. So first, we're just going to inspect the ear, any drainage, lesions, anything like that, any pain. When I look into the ear for the ear canal, I'm going to lift up and back on the pinna, and if that creates any pain, that could be a sign of inflammation or anything like that. So I'm just going to take a peek in, looking at the tympanic membrane, making sure all structures are intact. I'm going to go ahead and look at the other side. Okay, everything looks fine there. Now I'm going to do the whisper test. If you want to put your glasses back on, you can. So the whisper test, I'm going to have you put your hand over your right ear, and I'm going to whisper something that she should be able to hear in her left ear. Baseball. Baseball. Jacket. Okay, so no problems there. The next thing that we're going to do, we're going to look at the nose. So I'm going to start by inspecting it, making sure there's symmetry there, and then we're going to use a speculum, and we're going to look with a light in the nose, just making sure that there's no septal deviation, that the mucosa looks good, good and pink, nothing abnormal. Then we're going to look at the mouth and throat. So the mouth and throat, we're going to inspect just by looking at it close, making sure there's no lesions or anything like that. Then I'm going to have her open her mouth. And I'm going to look in there. I'm going to make sure her gums look good, no bleeding. Her oral mucosa is nice and pink. And I'm going to check for her, go ahead and say ah.
Ah.
Make sure her uvula is midline and no problems there. So then we're going to go to the neck exam. And for the neck exam, we're going to first start off by inspecting for symmetry, any pain or anything in your neck, and then looking for any jugular vein distension, any signs of problems there. And then we're going to palpate your lymph nodes. So for that, I'm going to use the first 3 pads of my fingers, and I'm going to start by the preauricular lymph nodes. Then I'm going to go to the postauricular, and then I'm going to move to the tonsillar, and then the submandibular, and the submental. Any problems, pain, or anything there? So then we're going to do the anterior cervical, and the posterior cervical, and then the supraclavicular, and I already done the occipital, which are back here. And we're just feeling for pea-sized lymph nodes that are easily mobile, not too much pain. If they were hard and painful, we would probably want to have further inspection on those, so there was no pain or abnormal sizing or anything like that. So this concludes our HEENT exam.